Let's study the results of a meta-analysis which highlights the impact of Prasugrel and Ticagrelor on platelet reactivity in patients with acute coronary syndrome. The main objective of this meta-analysis was to compare the impact of Prasugrel and Ticagrelor on platelet reactivity in patients with acute coronary syndrome. When it comes to the methods of this meta-analysis, a total of 4 electronic databases were searched to identify randomized controlled trials and cohort studies to compare the impact of Prasugrel and Ticagrelor on platelet reactivity in patients with acute coronary syndrome. A group analysis was performed according to three detection methods: drug dose and LD effect time, and the robustness of the results was assessed through sensitivity analysis. In the results, a total of 25 studies with 5,098 patients were eligible. With ticagrelor, the incidence of high-on treatment platelet reactivity was significantly lower than that of Prasugrel within 6 to 18 hours, and the incidence of low-on treatment platelet reactivity was found to be stronger with ticagrelor than that of Prasugrel. When it comes to the other clinical outcomes, there was no significant difference between ticagrelor and Prasugrel, be it myocardial infarction, cardiovascular death, stroke, target vessel revascularization, stent thrombosis, TIMI major bleeding, and bleeding BARC type greater than 2. The risk of bleeding BARC type 1 of ticagrelor was significantly higher than Prasugrel. Compared with Prasugrel, ticagrelor might have a stronger platelet inhibition effect with a lower incidence of high-on treatment platelet reactivity and a higher incidence of low-on treatment platelet reactivity and bleeding BARC type 1. While there might be no significant differences in the risk of thrombosis, ischemic bleeding, BARC type greater than 2, and TIMI major bleeding. When it comes to ticagrelor, a higher incidence of low-on treatment platelet reactivity might indicate a higher risk of bleeding BARC type 1.